Hello and welcome to Perspectives, where we take a deep dive into the issues of the day and where we take a look at people's opinion on such issues. I am Ruth Osime. The arrival of truly effective weight loss from injectable drugs like Ozempic, Mounjaro, and Wegovy is perhaps the solution many have been desperately waiting for decades. These weight loss drugs have soared to celebrity status in the United States. The company Novo Nordisk is making, the struggle they are having is making Ozempic and Wegovy because they simply cannot produce enough of their drugs. They're having issues meeting up with the demand of their drugs. It's a multi-billion-dollar market with more than 500 million potential patients. On social media, videos stacked with Ozempic have more than a billion views. But some doctors, psychologists, and eating disorder experts worry these new medications, originally developed to treat diabetes, could become a problem long-term, as none of them are risk-free. But regardless of this, some people believe the benefits they provide far outweigh the risks. There's also the Brazilian butt lift, BBL, a complex procedure where fat is transferred from your abdomen, hips, lower backs, or thighs to your buttocks, typically resulting in a smaller waist, flatter stomach, and larger buttocks. It's no secret that the Brazilian butt lift can be very dangerous. In fact, of recent, there have been a couple of reported deaths from this surgery. Despite this knowledge, it remains one of the most popular procedures amongst women. Then, there's also the glutathione injection treatment, which is very simple. It's quite similar to getting a vaccine shot. The dermatologist will prepare the glutathione injection by mixing multiple chemicals based on the skin type, color, and other factors. The injection is administered to your body through a vein. This IV skin brightening treatment works fast to brighten an even skin tone. But depending on the dosage, unwanted effects can range from moderate to severe. Today, we will discuss these products and procedures that have created such a buzz that its demand has far surpassed the supply. We are heading for a short break, but stay with us because coming up next will be our guest for this edition. Dermatologist Dr. Uju Rapu and cosmetic dermatologist Dr. Beatrice Nwalie. Perspectives will return in just a moment. It's that time when we tell you a little bit more about our special guest on this occasion, starting with Uju Rapu, who is a medical doctor with specialty in dermatology and aesthetic medicine. Dr. Rapu holds a postgraduate diploma in clinical dermatology and a master's degree in aesthetic medicine from Queen Mary's University, London, both with distinction. She is an associate member of the Nigerian Association of Dermatologists. Our guest, Uju Rapu, is the founder and CEO of Belfiore Medical Aesthetics and Serenity Medical Spa in Lagos. She advises on a range of treatments from non-surgical to minimally invasive face and body enhancement, skin injectables, awake liposuction, and fat transfers. We are also privileged to welcome to the show Dr. Beatrice Nwalie, the founder of Brick Aesthetic Clinic, a board-certified cosmetic dermatologist and aesthetic medicine specialist. She also focuses on weight loss, skin rejuvenation, facial balancing, and contouring. Dr. Beatrice Nwalie is known for her artistic approach to facial and body enhancement. She's committed to delivering safe, effective, and natural-looking results and stays at the forefront of all forms of aesthetic advancement. It warms my heart to say a big thank you to you both for being here on Perspectives with us. Now, where do we start? Because there are so many areas to cover. But let's first start with this Ozempic and Mounjaro and what's the other one called again? Wegovy. Do you understand? So I want to know, how does it work? You know, I mean, let's start with you, Dr. Beatrice. How does it work and how do you administer it?
These drugs, okay, so we have the semi-glutides, we have Wegovy and Ozempic. We also have the liraglutide, which is Saxenda, and then we have Mounjaro, which is a trizepatide. And these drugs, they work as subcutaneous injections given on anywhere around where you can find fatty tissue, like your stomach, your thighs, your hand, and they're injected subcutaneously into the body. And what they do is they suppress the appetite. Now, there are other there's a whole range of mechanism of action, and I wouldn't want to just go into those details, but the core mechanism of action is to suppress the appetite and cause the fat cells to be released so that they can actually be burned or used for energy.
Okay.
These drugs, they've been around for a couple of years now, almost a
but
decade.
they were supposed to be for diabetic patients.
Yes, they started off as for diabetic patients because a lot of diabetic patients are obese, and they wanted to give a drug that will reduce the blood sugar and also reduce fat in diabetic patients. But they found out that it has a more weight loss effect than more of a diabetic effect. So they started trying to administer it to non-diabetic patients, and they saw that it actually worked. So even with a diabetic patient, you still have to give them other anti-diabetic drugs. They can't just be solely on maybe Ozempic or Mounjaro. They have to be on other anti-diabetic drugs for it to be very effective.
Okay, now that you've said this, let's ask you, Dr. Uju, what are the side effects of these drugs? Because the people who use it are not exactly obese. So what are the side effects? If you have high blood pressure, or does it affect your liver? What are the,
First of all, it's important to understand that all prescription medication come with potential side effects.
Exactly.
We also know that side effects are usually dose dependent, meaning higher doses are more likely to give you more unpleasant side effects. So the most common side effects with these medications are what we call gastrointestinal, so tummy related. So bloating, indigestion, feeling a bit uncomfortable in your tummy. Some people, if you get the medication, start yourself on like a 1 milligram, super high dose, you're going to be more ill. Because
I've heard of dizzy spells and nausea.
We also need to remember, like Dr. B said, that it's a diabetic medication, so it also works to also kind of reduce the blood sugar. So some people overdosing themselves, taking really high doses without prescription, without supervision, dropping their sugar because they're not eating, and then they're overdosing, not doing things properly. So you're getting these side effects like exaggerated, really.
Like hypoglycemic effects.
Yeah, so what most of the headache, nausea is really your brain just not getting enough sugar.
Okay, but when these side effects do occur, what do you advise patients to do to curb it?
I don't advise patients buy these drugs and do it by themselves personally. They're prescription medication, so you should go to a doctor. A doctor talks you through and tells you what dose to be on. These medications also have protocol. You're meant to start on the lowest dose, let your body get used to it before taking up the dose. So after a prescription, we let people know signs of low blood sugar. If you're starting to feel a bit dizzy, have a drink. If you're feeling a bit weak, you can't move, reduce the dose, rest, have a meal. So it suppresses your appetite, but still be conscious that you still need to eat. When you eat, what kind of foods are you eating? So you have high glycemic foods that keep the sugar level constant in the blood with time. So we can manage.
Now that you said that, and that you said that doctors have to sort of supervise before the patients actually take it. Now, at what age or how long can you take it for? Is it something that you can do for the rest of your life? Or is it something that you take for 3 months, 2 months, 1 month, whatever, and then you now stop?
So there's some diabetic patients that are on these drugs for life.
No, I'm not talking about them. I'm talking about the ones that are taking it for vanity, not because of diabetes.
Vanity.
Yes.
Well, if you have achieved your weight loss goal, then you can stop. And when you stop, you have to also create a lifestyle to not go back to the way you were. If not, you just end up being in a fertile cycle where you lose the weight, you go back eating, and you start taking the drugs again, and you lose the weight. So you have to be very conscious of your weight loss goal. So you can't be on it forever. Nobody wants to be on a drug forever. Even hypertensive patients don't want to be on their drugs forever. So you have to modify your lifestyle. It's very important.
Okay, but is there an age limit? I mean, is there a time when you're either too young or too old to go on this?
Well, we have sort of children who are diabetic. So in terms of obesity, there's obese kids, which again, I believe is where specialist doctors coming, endocrinologists coming. So the doctor you're meeting is ultimately wanting to check that the benefit you're going to get from this medication outweighs the potential risk. So with all prescription medication, there needs to be a reason someone is put on it. So there needs to be an indication.
No, but what if the person is not diabetic and the person wants, the aim of taking the drugs is to lose weight? Can a child, for instance, be given these injections?
Some teenagers are on these drugs. Some very obese teenagers that are not diabetic. It's not far-fetched from it. You can place the teenagers on those drugs.
Okay,
but
so there's no age.
It has to be prescribed, and that child, it's not something you can get over the counter. Because I'm saying it now, and some people might be hearing this and say, oh, let me go buy it and then put my child on it. No, because for children, it will affect their organs a lot if they're not placed on the right dose and if there's no proper monitoring.
I want to point out as well that these medications were actually approved for use in people that are dieting and exercising to help. So in terms of, let's say I have a child who's obese, are you dieting, are you exercising? Why is an Ozempic medication the first route you want to go to for your child? So
when there are others.
Yeah, to start with. So it's really to help.
But you get clients who don't exercise and yet they want a miracle to happen.
We do. I do. And I counsel a lot because the thing is, that mindset is dangerous because when you come off the medication, the weight is going to come back. So you really have to work on lifestyle modification to help you. And I tell them the approval was really for people that are dieting and exercising. So that needs to be there.
So
otherwise,
you can't do one without the other. I think they have to work. They have to go hand in hand. But what about this Ozempic face and butt, where you now look gaunt? And
even if you did gastric sleeve or a bypass, you will look gaunt because it will eat up your fatty tissues. Now, the good thing about these drugs is that not only does it take care of subcutaneous fat, it also takes care of visceral fat also. So yes, you will look gaunted. So in the process of weight loss, people should understand that you won't look your best during the process of weight loss. But after you've lost the weight, you start to take back better nutrients into your body. You start to eat. Some areas will fill up back, so you won't look as gaunted as you were. So, but when I hear people say, oh, Ozempic face, Ozempic butt, I'm looking gaunted, what were you expecting when you were trying to lose weight? Do you think that the weight loss will be targeted only on one area? No, it can't be targeted on one area. You have to, it's global, it's everywhere, global.
So you're saying during the time when you're taking this this medication, you will look gaunt.
I do feel that if it also depends on the rate of weight loss, you know. So if you're losing drastic weight.
But if they're combining it with exercise, they will be losing drastic weight. And a lot of them will not. Now, you have to understand, if you're coming from 120 kg, and you're hitting 90, you're not going to have a gaunted face. But if you're coming from 80 and you want to hit to 60 kg,
which is the drastic weight I'm talking
about.
But
of course you will look gaunted because you would have slimmed down a lot.
Yeah, so I think that's more like total amount of like weight loss. But I think people, I tell people that can be modified a little bit if we're patient and say like, this is the weight loss goal, but I don't mind losing like 2 kg a week. So it's like your skin has time to kind of like compensate and people are getting used to what you're looking at. But ultimately, yes, if you're dropping from 140 to 80, it's going to be... But
if you're losing it gradually, like you said, 2-3 kg a week, would that avoid you looking gaunt at the end of the day?
It depends. I think it depends on the total amount you've lost. So if you come down from 140 kilos to 60 kg, I think it will be like you look gaunt.
You will look different. You can't look the way you were looking when you were 140
But I think you can look a bit less gaunt during the process if you lose it slower.
Okay. Yeah. So that's also something we need to talk about is finances. How many people have the finance to actually continue on these kind of medications because they're actually very expensive?
Because they're not cheap.
Yes. I agree.
So when you tell someone lose 1 kg a week and versus where he or she can lose 2 to 3 kg a week, they'll prefer to lose 2 to 3 kg a week and say, okay, I've lost a total of 10 kg and I'm done with the process. Then lose 1 kg a week and then they'll be stuck on it for about 2-3 months.
But realistically, what is the average kg that you can lose a week? That
it depends on the drug.
Okay.
Like with
are some stronger than the others?
Yeah,
which is
stronger. You can do 2 to 4 kg a week.
And Ozempic about 1
to 3. Mounjaro is stronger.
Yes, but with Ozempic you can do 1 to 3 kg or 1 to 3 kg.
Yeah.
Okay, we're going on a break soon, so we will continue with this conversation. So don't go anywhere. We'll see you right back in a minute or two. Go grab your tea, as I always say. See you soon. Back on Perspective. Okay, you were saying during the break, guys, that Mounjaro, what's the difference between Mounjaro and Ozempic? Which is more effective?
So Mounjaro is more effective than Ozempic. What happens with both is that they ultimately mimic a chemical that's going to your brain to suppress your appetite that your tummy releases when you've had a meal. So Ozempic has been found to mimic one chemical. Mounjaro has been found to mimic the one Ozempic mimics and a second one. So it's giving your brain like double signal to suppress your appetite. So people lose weight like twice as fast on that.
With Mounjaro.
Yes.
Is Mounjaro also twice as expensive as Ozempic?
2.5 times as expensive.
Like always what we're saying, people might come buy medication.
3 times.
So I think to really just tell people it's still prescription. So I don't want people to like say, oh yeah, we heard it's really good. We're going to go and pick up medication. And
yeah, but in other words, but what about what about even taking the medication? Should it be done in your environment or can it be done at home?
It can be done at home.
It can be. We offer as supervised, but some people are like, yeah, I want to inject myself, so we just teach them how to do it. But ultimately, I really feel strongly it should be under guidance of a professional and given to you by a medical person.
How often are the injections taken? Is it a daily thing or a weekly?
Once a week.
Okay,
on the same day. You have to pick a day. Once you start like on a Saturday, you have to continue every Saturday as you're taking that medication.
Yeah,
and the good thing about Mounjaro is that Mounjaro has less side effects than the Ozempic, and it can be dosed. So whereas the Ozempic has only 3 doses, 0.25 milligram, 0.5 milligram, and 1 milligram, with Mounjaro, the dose ranges from 2.5 to 15 milligram.
Wow, that's a long one.
So you're seeing a lot more results because you can change and opt the dose for the patient so that they can see better results with their treatment.
Okay, are you saying the higher the dose, the faster the effect?
The higher the dose, the faster the effect, the more side effect.
Oh, okay.
So ideally, you actually honestly want to be put on the lower dose first. Then you
You
find
wouldn't
maybe the weight loss starts like slowing
depending
down,
on your
so we
weight.
take you up. So now it's unlikely you're going to come in and we put you on like 15 milligrams basically.
Okay, so in other words, as long as you are following the instructions that your
You
doctor
can,
is giving
exactly,
you,
yeah.
it's something that it's not for the average person because I'm sure it's not cheap. I don't even want to ask how much it costs on air in case some people have heart attack.
Yes, and then some side effects that people should watch out for when they're on these drugs is belching. That's one of the very terrible side effects that it has. You can be constantly belching with it because it builds up a lot of gas in your body. So you either want to pass it out from the mouth or through the anal canal. So you're seeing a lot of belching and farting. Even hiccups, you get a lot of hiccups with it too.
Wow, that must be quite uncomfortable after a while.
Yes, it's quite uncomfortable, especially if you opt the dose a bit. And then some people have noticed a bit of, they call it abdominal pain, but I know it's a bit of abdominal paralysis because you find that, very strong pain that goes into your stomach. So you hear that discomfort a lot and headache.
Okay, now that we've covered enough about Mounjaro, I want to talk about BBL. I mean, some people might say I keep repeating the same topic, but I have realized, I don't know whether you guys heard of a few deaths that have happened recently.
Yes.
And I think enough attention is not being drawn to the negative side of these operations. And I think it needs to be highlighted. So I want to ask you, Uju, first and foremost, isn't there a medical board of sorts that needs to supervise people that carry out this surgery?
We do have a medical council. Generally, the world of cosmetic industry, aesthetic industry is relatively new. So I do feel that it's an industry that's not been given enough regulation, enough attention from the medical board. Because sort of the treatments are, there's like skin treatments, microneedling infusions, nail salons are doing things. So I also feel they're not actually even aware of what to do. So we definitely need like some sort of structure in terms of, I don't feel that anyone that's non-medical should pierce the skin. Because if you're aware, there's some news that was going around of 3 spas in the US that HIV.
Oh yes, the vampire injections.
From spas, yes. So I definitely think there's currently no regulation of the cosmetic industry that I'm aware of now, and I believe there should be.
There should be. I agree with you. You were telling us, Dr. B, of an instance that you heard about a lady that died recently and the amount of operations that she had, which was a bit worrisome because you said that there was no time lapse in between these operations.
Yeah, so some of these women, they've done over 6 to 7 BBLs and...
within a period of how long?
Sometimes within a period of 4 years, 3
Wow.
years. And they don't even tell the doctors. That's also the problem. They don't even tell the surgeon the truth, like when last they did the BBL, because it's said that after you've done the operation, you shouldn't even go back to surgery within the next 6 months. But you see some of them return back even after 3-4 months, claiming that they have not gotten the results that they want. And sometimes I've had to even turn back patients when it even comes to cosmetic procedures on the face, because I've realized that they have body dysmorphia, and I'm telling them, you don't need so much on your face, but they want it. And when they leave your clinic, they will go somewhere else to somebody who will collect the money and do the job for them. And most times you find it's even the unprofessionals that will collect the money and do the job because they just don't care about their safety. So the same thing with the Brazilian butt lift. You see a lot of the surgeons, they don't know that some of these patients have gone to different parts of the world, or even here in Nigeria, they've shopped from one surgeon to the other just to get an unrealistic expectation which they think is for their body. And a particular patient just recently, was demised recently, and is just she just had, I think, had done surgery maybe earlier this year and repeated surgery again. And of course, her body can't take that much.
No, but another thing that I've also wondered, do you understand, is that there are also non-surgical BBLs that you can do, that you don't have to really go under the knife. Can you enlighten that?
So we have a non-surgical BBL or surgical BBL. Surgical BBL is also known as a fat transfer. So we take out fat from certain areas and inject into the bum to enhance the hips. The non-surgical BBL uses what we call fillers. So fillers are an injectable treatment that basically help puff up the area a little bit. So we have different types of fillers. The thing with the fillers, they're non-surgical, so injections. Like I mentioned, any process that's piercing the skin still comes with potential risk. So again, it is a medical procedure. The thing with the non-surgical is that the results are not permanent. So a lot of people like them because there's no downtime in terms of get it done, continue with your life, but in about 2 years, it starts, wearing off. So the pro, or what they're normally looking for with the surgical BBL, is the results are slightly more longer lasting.
Yeah, but where do you get this? What do you have inside these fillers?
So we have hyaluronic acid fillers. Hyaluronic acid is a molecule your skin produces normally. So these are sort of manufactured in a lab to mimic that same ingredient in our skin, so your body recognizes it. And hyaluronic acid works by attracting water into the tissues. So it basically works to fluff up that area. And it feels nice, feels natural, looks natural as well. Then we have some other collagen-inducing injectables. So another treatment we have called polyl-lactic acid. And that works by sort of stimulating your own tissues to thicken up. So they're both around just getting, your body to thicken a little bit, but they're not permanent. After about 2 years, they start to reverse.
And they do have risk.
They do have risk.
What are the risks?
So with all injectables, once you're piercing the skin, there's potential risk of infection. Meaning that obviously the bum is an area where there's bacteria. So if you don't know what you're doing, you go in and pierce, you can, cause a really bad infection that can spread around. If you're not knowing where you're injecting, you're not knowing if you're putting the filler into the right layer, into the blood vessels, you can also get sort of...
Can destroy one of the nerves in the bum.
So you can have nerve damage, blood vessel damage, emboli, sort of clots of certain chemicals that we're injecting in.
Are these part of the things that lead to death?
Yes,
could be, yeah.
Could be.
Yeah.
I had a patient recently, I think last month, that she came in. She had done a Brazilian butt lift, non-surgical, in a clinic or sort of with a non-medical. And she started developing fever after 48 hours, which was a telltale sign that infection had already set in, and cellulitis, really? Yes. But when she had gone to the person that had injected her, the person said, that don't do anything about it, don't take antibiotics, don't, just leave it alone, it will go. And after like 4 days, she started burning up, and she could barely walk. So they brought her to my clinic, and the whole area was infected. And that's just from the non-surgical. It was entirely infected, and we had to start taking it all out.
How do you take it out?
There are other things you can use to dissolve some of those fillers.
The good thing is you can also dissolve some of them. We had to put on antibiotic treatments and everything. So in fact, I was telling her that it could have led to septicemia, because that area, both sides were infected, the hips. And if that infection had entered into her bloodstream, it would just be in a case of septicemia, and from septicemia maybe to death.
So do you think that some of these women who, embrace surgeries, some of them suffer from number one, body dysmorphia, and then number two, social media doesn't help because most of these pictures are, what's the word again?
Edited
and airbrushed.
Yes.
But they fall into that trap of thinking that what they see is actually reality. Have you found patients that are under that category?
I think that's another importance of going to professionals because non-professionals don't even know what body dysmorphia is. So just sitting down, we have a consultation first. We can pick up signs in terms of someone says, I've been here, I've been there, I've done this, I've done that.
I'm not happy.
I'm not happy.
Yeah.
So while we're listening to this, I'm picking up, is there anxiety? Is there a dysmorphia? And if you're treating a dysmorphia, you're really enhancing. You're not helping them. So really, the treatment for body dysmorphia is actually therapy, not to do more treatments. So there's certain treatments, like Dr. B said, that we'd say, no, you've had too much, it's fine. Can we talk to a therapist? So we always have to kind of bring that. Is there something you want to talk about?
Or what's going on in your life?
What's going on? And we find people say, I just had a divorce, so it always comes up. And I find the issue with going to non-professionals is like, you want this? Okay, here. They're just kind of like selling treatments. So it's very important to be able to identify when to say no to someone coming in. So we do see a lot of like potential body dysmorphia patients.
But you also find that some of these patients leave you and then now go to somebody
else.
Yes,
definitely.
Yes, because there's always going to be someone that will treat them.
Yes, and they will always talk bad about you sometimes. They say, and they try to get sympathy from the next person, making it so that they can actually get some treatments. Whereas you don't realize that I don't want to treat you because I see that you have some certain issues.
Okay.
But social media is one of our biggest problems.
We'll discuss that after the break. We're going on the break soon. We're going on the break soon. Don't go anywhere. We'll see you right back on Perspectives in a minute or two. It's funny that you mentioned this body dysmorphia, and I really want to dig deeper into it because I think a lot of women suffer from such insecurities that you look at a woman who's very beautiful, everything is in place, and she still wants to do one more thing. I don't know whether you guys know of one woman in America. I think they call her, I can't remember what name they call her, where she used to be pretty when she was young, but now her face is so deformed.
She's the cat woman. She's done everything.
Have you seen her?
Yes.
Like blonde, yeah.
Okay, imagine where she's coming from and how did she get there? Because you see some people who have done so much on their bodies, they are nothing like what they used to look like. So how do you advise women to curtail these things when they come and see you as
I think
clients?
You need a no-nonsense talking professional to be like, after a while, you look amazing, you look beautiful. It is okay to have insecurities. It's normal. We all have something, we wish was different. But I talk to people and just it's normal, but let's also focus on body positivity. What do you like about yourself? So let's enhance what you don't like as much, but just know you can't change everything 100%. And you still want to look a little bit natural, to be honest. So I really think it's for the professionals to tell them, you're beautiful and we need to stop here. Because if not, they're just going to...
But do you advise them to go for therapy?
I do advise therapy, yes. I do advise therapy. So if I pick up, something, because some women will start just talking, crying. They just sometimes want people to talk to. And afterwards, I'm not a therapist, but I would love to have you talk to someone. I had a lady, and I said, this particular treatment you're asking me for, I will do it if we talk to the therapist and she says I should go ahead and do it. And she agreed. And obviously, we found just...
But after she spoke to the therapist, did she still do it?
She was okay. No, she didn't use it anymore. So there are other issues that were being sort of suppressed and were coming out as her trying to overcorrect things. So I think I think we can definitely do more about talking about therapy, and it's okay to get help.
I think more awareness needs to be created.
Yeah.
For the mental health.
Because even before, but I must ask, even when people come for these operations and surgeries and what have you, do you actually dig deeper to know whether or not is something that they need to do?
You have to, because healing, if there's a link between mental state and healing. So for me, it's even if I'm taking this person through this procedure, it's my work and it's my responsibility. So I also want to make sure that the healing process is smooth for me. So if I'm taking someone in that has high anxiety levels, something going on, it's more work for me. So and I explain that to them in a way that, I really want you to be at a state where you're comfortable so that we know that the healing process is smooth for you as well. So whatever you're dealing with now, let's give it some time. So I think it's just how you communicate these things.
But speaking of healing process, what's the estimated time expected when you do have a surgery?
For immediate healing, you're looking at about a month after the surgery, especially with the BBL and the liposuction.
But is it true that BBL is very painful?
Yes. Not the butt lift itself, it's the liposuction.
Yeah, liposuction is
the painful part.
Oh,
yeah,
liposuction
the butt doesn't really hurt after doing the BBL. It's the areas that have the fat has been taken out from, that hurts
So
a
like your
lot.
stomach
So
or
yeah,
your
where
back,
there's
Yes.
more
More
trauma
trauma.
from the instruments.
Wow.
So yeah, you have a lot of
But is the
pain.
act itself painful as it's
I
being
mean,
done,
if you're
or is the after effect?
No, anesthesia takes care of the pain. You don't feel it.
So is it during the healing process?
It's
you
really
Yeah,
feel
like
the
you're
pain?
feeling when the
they feel the
anesthesia is
pain
worn off.
when
Yeah.
it is worn off. You're
Oh,
in
that's
severe
interesting.
pain. It's excruciating sometimes.
Are you
for-
serious?
Yes.
Again, I mean, it depends on again how aggressive the
That
surgery
doesn't sound
was.
very encouraging.
Depends on
Yeah,
how
but it depends on
depends how aggressive
But
the surgery
Nigerian
was.
surgeons are a bit aggressive because Nigerian women want
They want to, like,
good results.
They want to be
Yes.
snatched.
And it has been said that in Nigeria we give very good results because the surgeons are a bit more aggressive than comparison to
But is
the
that
United
more
States.
aggressive than necessary?
Sometimes it could be too
Sometimes,
much.
I think
it
so.
could be too much
Yeah.
because the body. You see a lot of very bad cases of liposuction burn on the
What
skin.
does that look like?
Oh, it's like a big burn around the abdomen or the
Wow.
back. We see that a lot. 'Cause- yes.
But does that heal properly?
No, because the skin now keloids or becomes hypertrophied.
There's
Oh my
honestly a
goodness.
really strong link between how aggressive a procedure is, how
Yes.
much trauma is
Yes.
caused to the body and healing. So sometimes this over trauma and wanting to do too much
Over-aggressive.
is more likely to lead to skin burns, issues are now difficult to treat or complications. So again, important for the doctor to say this is what is safest. But patients do put us under pressure.
Patients put the doctors under pressure. I won't lie to you.
Yeah, but as a medical doctor, are you allowed to be under pressure by any patients? What
No,
do
but
what's
you know
really
this
logical?
is an elective procedure, and it's a lot of word of mouth. So if you don't get it right, maybe the patient is not satisfied with your work. They will go out there and tell people that you did a bad job.
Also,
for
would
them.
you now do something against your own principle just
I mean,
because?
that's not me. I don't do liposuction, but I'm telling you, this is what the doctors are also facing. Those surgeons that are doing liposuction, this is what they're
I
facing.
think because
The
I do
pressure.
a form of liposuction, and some people coming and say, "This is what I want. This is what I want," and
And
I
they put-
like to stick
Yeah, but
within
your
the scope.
reality should be what
Yeah, so I
determine
stick
your-
within
your-
the scope of what I'm comfortable with. So I'm fine telling people, I'm not comfortable with what you're asking me for. Go somewhere else. Because there's always going to be someone else that will give you what you want.
Some people want it very. You have to consider it through finances. That's why I went back to finance. Our GDP in Nigeria is very low. A lot of people are not making so much money. So the little money they've gathered to say, I think if I do this one procedure, it's going to change my life.
Yeah, but you have to you have to tell them the reality of it.
Of course, we have to tell them the reality. I'm just telling you what people are facing.
What they're thinking, really.
I will tell you too that a lot of women who have done liposuction, their lives have been changed.
As in how?
Exactly. So their confidence level has been
confidence
restored.
level, yeah.
You know, a lot of women have, done this treatment and it has boosted their,
that's understandable.
confidence so much.
That's understandable.
And these people might not have so much money. They just have a little amount of money and they want to just see if one procedure can get them the best result. That's why sometimes they put so much pressure on the doctors. I mean, a doctor shouldn't succumb to the pressure.
Exactly, that's what I'm saying.
But it is what it is.
Is that why you sometimes see? I mean, I see some of these BBLs and they're ridiculous.
Yes.
I mean, the woman enters and 10 minutes later her bum hasn't even entered.
Yes.
Finally. So I'm saying to myself, I mean, come on, whoever did this operation on this young lady or woman or whatever should have known that don't pass it. I mean, I'm assuming that the shape of your butt is determined by your size.
Yes, and your thighs and
your
your
thighs
legs,
and
yes.
what have you. So sometimes when it's too extreme, I just wonder that.
But it's mostly men that are doing these procedures, and they're
Honestly,
not very artistic.
honestly.
To be honest with you,
Yes, to be
the
honest.
honest,
Realistic
yes.
with their-
No, they're not as artistic as if it was a female
Okay, I
surgeon.
never thought about that.
I noticed,
Yes.
and I also feel
Yeah.
that like sometimes.
Also,
'cause
you can tell the difference between a man, what a man has
Yeah,
done.
because
and what a
patients
woman
also
has
say
done.
sometimes when I went to the male doctor, I went back, they just said, please, whatever.
Yes.
But when I go to a female, it's kind
Yes.
of like,
and
we
there's
can
some
talk,
really
you
good
understand.
female
Understand.
surgeons in like the Dominican Republic
Yeah,
that
so
do
there's-
some really good jobs. So when you hear people say they go to DR, it's because there's a lot of female surgeons there that are doing the BB. Yeah, the male surgeons are not very artistic in their design.
So in their mind, it's just
put the bomb.
go.
Yes. Put the bomb, snatch the waist.
Because that's what
and-
they ask you for
and
as
that's
well,
all.
to be honest. Because the
But-
interesting thing is, if you ask these women that have the really big ones, they actually like it. So
Yes, they like it.
It's you saying this doesn't look natural, but
Yeah.
they're fine with it because if you wanted to, you could remove it.
Yeah. I don't like a big butt.
I mean, I don't even mind if it's nice and pert. It's when it
That's
just
what
looks
they-
like you
that's
have
what they want.
two huge calabash
But
behind
some of them,
you.
that's what. And
That's
then
what they
the only
want.
time you hear them saying they want to get a reduction is when it starts hurting their knee and
Oh,
their
it
ankles.
affects the knees?
Of course, upper body weight versus lower body weight.
If you put on weight,
yes,
wherever
it
there's
will
fat
cause
cells
you
keeps growing
arthritis
as well.
in the long term, osteoarthritis, wear and tear. You're putting that much weight on your knees and your ankles. Most of these women who have those ridiculous big butts are all suffering from knee and ankle pain, and they just
What about the
don't
ones that
tell
also
you.
do their breasts beyond?
Yes, you will have back pain.
So the thing
that's
is, I think it's
interesting.
just about extremes, because I believe you can have a nice looking BBL or have nice looking work, but I think it's just kind of like where you just keep going extremes. I want to do 4 BBLs, 5 BBLs, that starts getting a bit.
But you know, it
with the
starts
side
from one.
effects.
And then they tell you the body it's not fitting into the dress.
Yes,
and then they say they want the, they want the dress
before
to
the procedure, so you don't take our clients like this.
and then they add more and more
goodness.
and more, and by the time they keep adding,
You have to
you're
consider mental states before the
personally,
surgery.
I don't like a big butt. Like I said before, I like it looking slim and trim. That's
It's nice
me.
when it's
But
perfect.
that's
Yes.
not, it's
Possible.
no, that's not everyone's preference.
But that's not everybody's
Me too,
preference.
yeah.
But I want
You
to
too, you
ask,
like it.
I just like
It's
my.
just
but I want to ask another question. Okay, when you now say it's too big, with boobs and the butt, and you say you want to reduce, what's the skin going to be like after you've taken out the excess?
It
So the
depends
thing,
on-
the thing with liposuction is whenever you take out an amount of fat, there's like a space, and the skin is always going to be a little bit saggy.
How
so
can it be like orange peel?
No.
No, but you can do laser.
You can do there's skin
lipo.
tightening treatments, do laser treatments, pedio
Laser
tightening
lipo.
treatments, and you have to wear compression garments wherever you lipo, so it kind of like helps with the skin tightening process. So there's ways to kind of like.
Oh, okay.
So when they
treat
take it
that.
out, they still put some
So it's not
laser.
like if you take it out, the whole thing is just going to be
No,
lymph and-
With-
no, no.
There's
It-
ways
with time.
With time, there's ways to sort of
But
sort
you
this
know,
out.
if you take out a ridiculous amount also,
Then yes,
it's
it's
real
more
sag.
likely. Yeah.
Because the skin has stretched and the
But
skin is
so when it
elastic.
sags, you now have to inject collagen.
Or just do skin tightening
You just do
treatments.
skin tightening.
Oh, how long
treatment.
does it now take for you to now get back to where
It
you
depends
were?
on the age of the person, the collagen producing capacity of the skin. So
Yes.
if they've been bleaching, so lots of things come into effect. But skin can be
We are
tightened.
going to talk about bleaching soon. But I want to ask, when is it too old to do plastic surgery? When are you too old to do plastic
I
surgery?
think your risk from surgeries increases with age. So every doctor, every surgeon has their own sort of guidelines they go by. So in terms of, I take people between 30 to 50. So I think that's a kind of related to the surgeon.
Maybe the work he has
was
done
comfortable
and
with
what
them.
he's
So
comfortable
some people
with.
take
And
on
he's
older
an
people.
anesthesiologist.
But you also need to be aware that the older you are, there's more likely to have other comorbid effects that can make you more prone to like
Especially with
complications.
anesthesia, the anesthesia.
Anesthesia,
They can have more
yeah.
anesthesia-related,
Then more medical
complications.
issues. So it makes it more risky.
What are the
older you are.
anesthesia-related complications?
You have spinal shock. Some
You
people
can have,
have
like,
a respiratory distress,
Allergic
that?
pulmonary
reactions.
embolism.
You're not talking to a doctor. Hey, this is your big grammar. We speak in layman's terms. What are the side
Breathing
effects?
issues. You can
Okay.
have breathing
So
issues.
anesthesia
Depends on-
suppresses your respiration.
Yes.
If you're someone that's generally not very healthy, maybe
Yes.
you're diabetic, you're hypertensive, there's already things, you're on medication.
Yes.
Just adding something else you don't need that is
need.
elective can increase your risk.
risk of.
Okay.
You know.
Maybe
But what-
part of the lungs are probably already
Yeah. So
failing.
just general
What about when?
complications.
How? At what age is also too young to have?
Once you're at the age of consent,
Which is currently about 18 now.
then you
So
can.
14, 15, it doesn't make any sense unless it's
It doesn't make sense.
even 18.
But that's the
it
age
doesn't
of
make-
consent.
That's the age
Okay.
of, yeah.
So
I mean, it doesn't really mean
for
the person
doctors,
is,
we don't actually look at the age. We say age of consent. As long
Okay,
as
well.
you
and you're
are
like, yeah, an adult.
past that age and you're an adult, then you can go ahead and do.
Okay, let's talk
What you
about
wanna
this. What is it, glutathione and vitamin C IV therapy that is being performed. I've also heard of instances where they don't use professional nurses, and I've also heard about 1 or 2 deaths that have actually occurred through this procedure. So how fast at this is it? How effective is it when you take these injections? And do they work faster than bleaching creams?
Okay.
Okay, so glutathione is actually a compound that's produced by your liver naturally as something called an antioxidant. Antioxidant means it protects your cells from damage, so it has a role. As we get older, your body isn't producing as much things. So it does have a role for anti-aging, antioxidant protection. Glutathione has been found in slightly higher doses to suppress melanin production, meaning that I have a normal amount of melanin. If I go out and sit in the sun, my body wants to produce more. That's what happens naturally. So the purpose of slightly higher doses is to reduce that, meaning that if you're doing it over a period of time, it could potentially lighten the skin in combination with other skincare, sunscreens, exfoliant products. Everything related to dose. But again, like I said earlier, side effects are always related to dose, and all medication have potential side effects. So some people will come, I want to be super light, I want this crazy high dose, which we know is not safe, and we know a regulated dose to stop at. But we're aware now that like nail studios, spas are offering infusions, and based on what their client is asking as a business, they will just give them that. So the complications they're looking at are linked to a lack of knowledge of the product, linked with poor patient selection in terms of we check blood pressure, because giving someone a fluid drip without checking their basic factors can be really dangerous to them, which people don't realize.
Fluid, you can have fluid overload.
Yeah, exactly. So
what is fluid overload?
Like putting too much fluid and your heart doesn't have enough capacity to pump.
Yes.
So they can be very dangerous.
But don't they gauge how much fluid should go into?
If you're going to a non-professional place, they don't know what they should be looking at.
They just open a drip and
they just open a drip because they're publicizing it all over as giving vitamin drips is like in fashion now.
Yes.
So in terms of you ask the speed of skin lightening, it depends on the frequency and the dose. But then to make people aware that there's doses we shouldn't go by for safety as well.
Okay, but what about the case? I don't know whether you guys heard of the case of the woman who died. Something about they didn't inject it into the vein or something, and it went straight to her heart.
They're also injecting wrong medication, because I had a gentleman come actually from out of town, and he had gone and asked for a particular medication to inject himself, and they sold him a steroid.
Wow.
Yeah.
So he had a nurse come. The nurse was just like, let me just inject
That's
you.
another topic to talk
And then he
about.
ended up in hospital. And they told him, so I said to him, bring what you injected. And we actually it said glutathione, and we peeled it back, and it said like corticosteroid or something.
I think dexamethasone.
Dexamethasone, yeah. So he was injecting a steroid into his
before.
body and ended up being sick.
Oh my goodness.
Yeah. But so they're also selling fake products.
So they're selling
basically.
fake products.
Oh God.
Yes.
So how would you, the person using the products, know whether or not it's fake?
So you should
I only offer what people don't bring injectables off the internet and tell me to inject them. I only
offer what
we know where we're getting it from.
So in other words, it's best to go to a recognized clinic and actually take their products rather than. But they don't say it's over the counter, do they?
No, they don't sell it. The prescription. I'm not a big fan of glutathione injection.
Why is that?
Because, first of all, you're trying to get a skin lightening effect. Whether or not you take the IV infusion, you still have to use some form of topical cream.
Okay, that's
on the skin. And a lot of people don't want to use topical cream. They want to use IV infusion, which is not feasible. You have to still place in topical cream. Also, the constant taking of IV infusion is damaging some of your veins, because a lot of these women, they've used a lot of products that have thinned out their skin. You barely can even see their veins anymore. Then you're now going in electively every week and you're using up one vein or the other. By the time you actually need to have a serious procedure, or you need to be given intravenous injections for maybe a condition you have, the doctors might not even find any vein.
Oh, are you saying the more you apply it, the less your veins become
Yes, you
visible?
tissue the veins, and they become what's that thing they call it? It becomes hard. Yes, it becomes thrombosed. So I'm not really a fan of it. I do tell people a lot, if you don't need it, why are you taking it?
But what about the vitamin C that they said?
The thing with the glutathione and vitamin C's, I offer them for sort of like the antioxidant benefits.
Yes.
So I don't really have anyone that I'm like, come and do weekly for like 10 months.
It's not
Some
good.
people would say, I've come back, I'm a little bit tanned, I want to glow, because we do find it gives a nice glow as well.
Nice
But I usually give them glutathione and vitamin C.
Vitamin C.
They work really nicely in
together.
combination. Yeah.
Okay.
So
not every
it's
week.
normally like a set period we tell them for. I personally like maybe like 4-week period or something. But in terms of like
4 week of a weekly, 4 week period
depends
of
on
a weekly basis.
Depends on your goal really. But honestly, I don't promise anyone I'm going to take from my color to like your color, because you're literally going to have to do so much other work, including skin bleaching.
Yeah, and it has adverse effects. So
Yeah.
I've seen a lot of cases.
What are the adverse effects?
You see people having allergic response to it, hives. I've seen a lot of that. There was a patient that I saw rashes all over her neck.
Oh my God.
So I now said, what happened? She said she went to a nail studio. They gave her IV glutathione.
I was going to say, what are they giving?
But why is this nail studio giving this injection?
Because I think businesses now, because
Yeah,
we
they just
had some
nail
spas come and
studio.
say, oh, the industry is expanding, what else can we offer? So I've had people say, can you come and teach us Botox? And I'm like, no, because people in the beauty industry is like, you go to a nail studio, can you just give me everything here? Can you do that? So for them, it's like business. There's people asking, I will supply it for you without thinking about safety.
But you can't exactly achieve. I mean, it's not as if you take these injections, this IV, whatever you call it.
You become Snow White.
Exactly.
No, you have to do so much more in terms like
You
topical.
still have to do topical. Yes, you
topicals,
still have to use topical. That's why I said it's not instant. It's not instant.
Yeah, but can you get rid of burnt marks, for instance, if you have black patches? Or
No, that wouldn't be my first choice of treatment.
For
you have to, it's
black
best to
patches,
actually topical. Like you have to treat what
this
it is
area.
there. Yeah.
Because you put in an IV infusion, it's infusing all over your body, so it's being shared to different parts of your body. But when you put a topical product or a cream on a particular focus, it's a focal area. You're going to that particular place where the pigmentation is, and you're treating it.
So would you say you disapprove then of this
like I said, for antioxidant effect, yes, I can tell you to be on it for a few weeks. That's fine. Even when we do procedures, you can be on it also because vitamin C helps with healing. But for me to say I'm using it for skin lightening effects, I haven't even really seen, to be honest with you, in all my years of practice, I've not seen anybody who has used this particular product and has become like Michael Jackson.
Are you serious?
Yes.
And I do see good things because
I see the body glowing. Yeah. I see there's more radiance, but white. No, I don't.
So there's other benefits basically. So it's disapproving it being used incorrectly in non-medical settings.
Like anything, if you overdo it. Are you serious? But that's interesting. But what about collagen injections? What about regaining elasticity in your face? Because I also see that people are very used to Botox. Do you understand? But there's also that issue of when they stop using the Botox, they now look more wrinkled.
No, it's not true.
No,
that's not true.
Yes, it's not true. I would like to debunk that.
No, but there are some people who now look older than their real age after they stop using Botox.
No, that's not true.
Oh, it's not.
Yes.
Please debunk that. I'd like to hear.
Let me explain. Okay, I'm aging. As I'm getting older, of course I'm getting older. I have Botox on my face right now, let's say. But
can you frown?
Of course I can frown. Can't I frown?
Well, I can see a few lines.
Yes, of course, a few lines. It's wearing off.
I used to hear that you can't frown when you
It's wearing off. I need to top it up.
No, but doesn't it look unnatural when you can't frown?
No, it depends.
I have a different view on that.
It depends.
No, you must tell me your view. I'm curious.
It depends. It depends on how...
I must say your face looks flawless.
Thank you. It depends on how you do it, how it's being done. But now, the issue with when you stop Botox, you look older, is that Botox sometimes is like a camouflage. Whether or not you're using Botox, you will have those lines, you will be aging. You will get older. So, if I start using Botox at 35 and I'm reducing, I'm not seeing lines on my face, like forever. I'm not seeing any lines for 10 years. And I decide after 10 years that I will no longer use Botox. Please, you will start to go back to status quo, the way you were supposed to look. It's just that it's like, it's a surprise for you because you have not been seeing that part of you like that. Whereas you take another person who has not been using Botox since she was 35 and is aging the way...
Isn't 35 a bit young to be using Botox?
It depends on how you age. Some people age faster than others. You've seen some people 25, they look older and they look like they're in their 40s. Would you tell them not to do anything to help
But
themselves?
how long... But is Botox something you have to do forever?
If it is... It depends on what you see as...
What you like.
How do you view yourself?
But how often do you do it?
So, it's usually 3 to 4 months, but me, I recommend 6 months.
I recommend
6 months,
9 months, to be honest.
6 months.
But you were saying you disagreed with some
you mentioned it looking unnatural, and I think it can look unnatural sometimes. And what I've seen is where there's sort of excessive, for example, and which is could also be the person doing it. So I like to do a full face approach. If someone comes and you just freeze their forehead alone, and then you see them smiling and there's lines
you can't even freeze the forehead. The brows will drop.
I've seen some work, and the person, and they're like angry, and there's lines everywhere, and their forehead is not moving.
Not moving, yeah.
Wow.
I feel like ultimately, I feel the point of the procedures is to kind of like slow down the appearance of aging without making it look like you obviously did something to your forehead.
So if you had to do Botox on my face now, what would you do?
No, if I had to treat your face, first of all, your face is beautiful.
You've always wondered because I've never had Botox.
Yeah, you need Botox, definitely. Anti-wrinkle, forehead, you know, in between your eyebrows, your eyes, definitely. You're aging a lot on your eyes, but that's because of the type of work you do. You get to see the cameras and everything, so it's straining a lot. So you will need Botox there. Then you need some skin treatments, like some collagen boosting treatments, peptides, vitamins into your skin. I wouldn't necessarily put dermal fillers on your face right now because your face has a little bit of puffiness. So I know we talked back where you said you wanted to do something on your nasolabial fold.
What's that?
That's your smile lines here.
Oh, okay.
But I don't really see she needs so much there. I
feel like what I would do, I agree. I think you look amazing. I would ask you if there's something that bothers you.
She already told you backstage.
I'm just telling you as a general. I'll ask you if there's something that bothers you.
What did I say?
You were saying a lot.
And then I recommend, like Beatrice said, collagen induction treatment to everyone, because we know collagen is decreasing. So you want to do microneedling, lots of nice treatments we have to boost collagen production.
Thank you so much, Dr. Oju Rapu. Thank you so much, Dr. Beatrice Nwalie. I really, really found this most interesting.
Yes, thank you.
Thank you for being with us on Perspectives. I hope that to invite you again sometime soon.
We'll come.
Thank you so much for being with us. Now, everybody wants to look and feel good about themselves. That's why a lot of people around the world are spending millions on complex cosmetic procedures. At a certain age, we are overwhelmed by the desire to renovate our bodies, our faces, our looks, our lives. But it's not as easy as trading in a car or getting a new kitchen. Nor ultimately does an external fix have staying power. To make real change, we have to start from the core and work outwards. Even though becoming more body confident is a need of the hour, positive body image is a practice rather than a destination, and your appearance, though important, should not be the only feature of who you are as a person. My usual phrase, life is a learning curve. You've been watching Perspectives here on Arise News with me, Ruth Osime. Many thanks for being a part of the program. Do have a blessed week. See you next week.